that's a really good segue, Rudy, because that's where I really want to start is currently right now, what is your decision process surrounding return to run? Like what kind of criteria you're looking at? Let's use, I think ACL is a really clean example because it's something that's a little bit more predictable or at least standardized as far as like progression sequencing. So it's a good way to, I think, start viewing this. So right now, like if you're taking a patient, like what are you looking at? And like there's no wrong answers here. So like are you looking at like, oh, doctor cleared them at 3 months, so we're ready to start now? Or are you looking at certain quantitative measures, qualitative measures? What is it right now that's kind of guiding your decision making?
Yeah, for me, it's looking at force testing first and seeing if they're at least at 70% limb symmetry index, but also looking at just overall torque to body weight just to see if they're also strong on the other side.
Sure.
And then looking at things like lateral step down, pogos. I've been using that 1 minute double stance like pogos for a minute, and then looking also at single leg for 30 seconds. Um, and some of the other criteria leading before that, there are things that we'll use like wide balance test and seeing if they're near symmetry there, as we're kind of progressing into more of the strength phases. Yeah, and then as we're kind of progressing locomotive drills, just seeing how things are, how she performs, just on working towards like skipping and things like that.
Awesome. So what torque to body weight ratio are you looking at currently, and why?
Um, so I've been kind of going off of at least maybe 60%, seeing if they're at least um, above 60. It's kind of.
Okay, cool. Yeah, that sounds similar to what I've looked at. What I've seen in the research is there's some stuff I've seen that's like 1.7, 1.8 newton meters per kilogram is kind
Mhm.
of one of those recommended metrics that they've looked at. But overall, like what's funny about this is like I've kind of swung back and forth on it. Is it's we're we're doing all these measures to look at something that's relatively benign if we're doing it in small doses, right? Like I think we make this really big fuss about return to run. And like, I just remember myself, like with ACLs as it coming into practice. And it's like, oh, wow, it's 3 months. The doctor just cleared them to run. Okay. Like, I'm like, all right, let's start running. And the patient's like, okay, I'm going to start running. And you're both kind of like crossing your fingers, hoping it goes okay. And what I realized during the process is like, really return to running should be this continuum where like you're titrating the stress over time with certain drills that really once they start jogging it just it's like one little notch above what they've been doing. So I like that thought of like a titration, like in we all have horrible memories of chemistry lab, I'm sure, where you're just slowly drip dropping the solution in, right? And eventually that solution turns pink, right? Once it hits a certain threshold. So for us, that's what running is. So it's something where I can start with locomotor drills, right? As I'm preparing other qualities in the background. So I think the foundation of a return to run process is going to be surrounding marching, skipping, pogo, all of these things that are kind of the constituent parts of running. So when you think about an actual jogging motion and we talk about an ACL, like what are you most concerned about? Like what is it about the ACL and the constraints from that that make you worried about running? So like the forces of running. Let's elucidate that a little bit. Does that question make sense?
Like absorbing the force.
Yeah, like so, like the decelerative capacity, right? So
Mhm.
I need to be able to, I need to be able to step forward. I need to decelerate as my center mass is coming forward, and then redirect that force as I fall forward and push through, right? So if we start talking about an ACL, it's going to be that initial braking force that's going to be our problem, right? So if we're talking about a quad controlling, that's why we're worried about quad torque, because we're worried about the ability for your quad to actually that iso knee extension moment to actually control that force. So let me ask you, if I'm doing like a lazy jog, okay, meaning like I'm reaching, and you kind of picture that where someone's like they're landing in front of their center of mass and they're kind of stumbling on top. And think about that shock of that motion versus if I'm doing like a high knee run where now my foot is landing underneath my center of mass. Can you picture the difference in braking force from one to the other? So really, if we start looking at return to run more as like, I guess, a track coach and start teaching it in some of those drills versus like, all right, let's just start jogging, the transition is going to be easier because these track drills are actually a little more efficient and they're actually a better transition to running than jogging is. I actually think slow jogging is the worst way to return to run. And that's what I used to do. And what I found is that if you enter it the other way, if you enter it through some of these other track drills, you start finding that they're going to start running with a little more efficiency. They're going to start running with that foot underneath the center of mass, and that's going to decrease that braking force. So when we actually start talking about the different mechanisms, let me try to pull this, see if I can share screen here. Hey, Corey, are you on here?
Yeah.
Can you give me screen sharing permission?
I do not know how to do that. Do you know how to do that?
Yeah, if you go to share screen, or if you click on, I think if you click on the 3 dots by my square,
Okay.
it'll say make host, and you'll give controls. Yep, got it. Perfect. All right. So let's pull this up. Can you guys see this slide? Yeah. Okay.
Yeah.
All right, you can see this still? Okay, so the square on the right is now so this is vertical ground reaction force over time. So what we're looking at is this impact peak and this active peak. So in a situation where I'm landing hard and I'm landing in front of my center of mass, this is the graph we're getting. So we're getting this hard hit, this impact peak, a slope down, and then an active peak. So we think of the impulse, the force over time here, it's going to be a hard, rapid hit. So think about, is a post-op knee going to like that? Probably not. It's not going to like that fast loading rate, okay? Versus this side, this is more of a landing underneath the center of mass type stride, okay? It's going to be smoother, more of a cyclical type stride. We're going to have a slower loading rate, okay? Smoother slope, and we're not going to have that jolty peak. So when I'm looking at returning to run, this is what I have in mind, because what's going to create most of the problems, whether it be an ankle or a knee or whatever, the body's not going to like these fast, jolty loading rates initially. So I think what's really important to do is to start translating this graph into your ability to like look at it. So think about someone who's like at an antalgic limpy gait where it looks like they're stilting and they're just like kind of hitting hard. And it's like, ugh, they're not ready to run. That's this, okay? That's an extreme version of this because they can't delay the deceleration. They're going to just peg leg it, right? So now it's just jolt, jolt, jolt. So those are your indications that this person is not ready to run. And Rudy, the things you were saying previously are all proxies to tell you that the probability that they're going to be able to present with the rightward graph, with the graph on the right. Does that make sense to everybody?
Yes.
So we're looking here as we're looking at trying to understand what kinetics and kinematics are going to affect this, right? So if I can't control motion with a little bit of knee flexion, I'm not going to be able to get into a position to create this smooth graph. I'm not going to be able to be in position to absorb, like you said, or redirect force appropriately. So we start looking at this and some of these kinematic variables is like, if we start breaking down what resilient running is, it depends on like, and this is looking now across like what makes, like if you look across all the running literature, what is most important to resilient running? So there's going to be certain kinematic variables. So it's going to be what's most important across all literature is not even so much forefoot strike or rear foot strike, but location of the strike. Where is a strike in relation to my center of mass? So the reason forefoot striking became more in vogue and like barefoot shoes are is if I put someone in barefoot shoes, they're not going to want to have that really hard strike on their heel. It's going to hurt. So they're going to self-organize to striking underneath their center of mass. It doesn't mean that's more appropriate. It just means that it moved them, for a lot of people, move them closer to a strike underneath their center of mass. So that's kind of one of our main KPIs is, and again, it's not going to be perfectly underneath it. I'm not looking to be like a 100-meter sprinter, but I want it maybe just a little bit closer than what it has been or what it might be. Okay. And then we're looking for vertical displacement. So is the person's head bouncing up and down? So that's something where you can call like a Tigger runner. Okay. I think Tigger in Winnie the Pooh, right? Is it bouncy? Because think of that vertical oscillation as now increased displacement load on that knee, okay? Or whatever joint we're talking about. So kinematically, these things are going to affect our joint angle, and that's going to affect the way that the tissue is loaded. The way the tissue is loaded is going to affect how fast we adapt and if this person's ready or not ready for that stimulus. Here's my kinetic variables. So some of the kinematic risks you start talking about when in terms of running is like, we start looking at like knee flexion angles, increased pronation, greater clear angle. But like, again, plenty of studies are showing no association between these things. So the biggest things we start looking at is like, what's our history of previous injury, right? And again, if we're talking about returning to run, we need to understand what those current constraints are. Any questions with that? Okay, so let's go back now to this conversation about Ariel. Let's talk about the situation you have right now and use this as a case study. So where is your patient currently on their rehab process from a return to run standpoint?
So she's kind of a special case because she went back to sport and was actually sent over by her coach. So she has been running. So it was about 13 months ago that she had like a tibial plateau fracture. They released her to sport. But right now, kind of what's happening with her is she's having, like I said, just pain. She's got poor motor control. So that's something we're actively trying to work on. But with regards to running, she loves to be on her toes a lot. And as soon as she starts running, she goes into like internal rotation with both hips. So it's funny that you said that, because this week I was like, let's try a slow jog. And now I'm like, oh no, maybe that wasn't the best idea. But I was like, I got to start somewhere with her, because even just like speed drills, like cone taps and stuff were causing her pain. So I've kind of been confounded on what to do with her a little bit. But right now she's like totally healed, no ligamentous issues. It was just strictly musculoskeletal, and it's healed, but she's having pain like still right at that joint line, just with like basic loading right now.